In Joseph Hospital, we have the only smoking cessation clinic in the province. The other smoking cessation clinic that exists in South Africa is based in the Western Cape. So we are the second smoking cessation clinic. And we're very fortunate to have a clinic that is supported with medications. So smoking cessation is notoriously one of the more difficult realms of addiction to deal with. It's commercially available and it's a legal substance that people use. So we have now got state-of-the-art drugs that we can offer our patients, which are cost-free, that can help them in their quit program. We take patients from every walks of life. The only prerequisite is that a patient must be motivated to want to quit. And regardless of their status, of their disease status, of their health status, we are happy to see you if you are motivated to quit. This is the place to be. To access our clinic, you just have to contact this number and say you would like to book for the smoking cessation clinic, and the clerks will either offer you a date. If there are no dates available, they will take your contact details, and when a place in the clinic becomes open, we will then contact them and say there's a place available, are you still interested in stopping smoking, and then we would advise on a date to come in. We try to design it in a fashion that patients can come in on a date that's convenient to them. They don't have to sit in a clinic for long hours with sick patients. So they come in, see their doctor for their primary interview, decide on a quit program, and then follow up either telephonically or what is most convenient for the patient. So it's quite variable, the number of patients that come, and it mostly depends on what's happening in the community around COVID. Patients tend to avoid the hospital when we're having a COVID surge, and that's understandable. And when the COVID numbers are low, then we have a flood of patients wanting to access the service. So what we would advise is, I think it's appropriate if patients are concerned about their accessing a hospital where they may be exposed to COVID, is to phone us rather and speak to us telephonically, and we can devise a time that they feel the safest to come and see us. So we started our smoking cessation clinic about 8 to 10 months ago, and we offer it every week for any patient that wants to come. Like I said, what we'll often do is screen them on the telephone and see when it's convenient for their first meeting, and then we do it to custom make it the most easy way to quit smoking. So the thing with smoking is that it's quite a complex addiction, and a lot of our patients do relapse, but that doesn't mean they haven't quit. A small relapse doesn't mean they've quit. 1 cigarette in 1 year, I would still consider that successful quit. It's just a small relapse. And the majority of our patients, 60% of our patients, when we use pharmaceutical interventions, have a sustained quit at 6 months.